Hi, everyone. Thank you so much for joining us. Today we have Dr. Jeffrey Solitzer on with us from SmileDirectClub. Hi, Dr. S. Thank you for joining us.
Sure. Hi, how are you today?
Hanging in there. How are you doing?
We're doing great, thank you. All excited to answer some of your questions and share our story a little bit here.
Yeah, we are excited to have you on. You're the Chief Clinical Officer with SmileDirectClub, and I know there's a lot that you guys are up to right now. So I want to just start off by giving our audience some insight into SmileDirectClub. Can you dive into the company and tell us about the telehealth platform that you've built?
Yeah, sure. Smile Direct Club is a direct-to-consumer teledentistry platform that's designed to help customers address mild to moderate, like spacing and crowding of their teeth through remote clear aligner therapy. Our network of 250 state licensed dentists and orthodontists prescribe the care, they manage the care, and they direct the care from the very beginning of treatment to the very end. So it's always doctor directed and doctor managed. And Smile Direct Club's mission is to democratize access to a smile that everyone would love to have. And our value proposition is basically threefold. It's providing access to care, particularly in situations where you might not have an orthodontist or a dentist who does invisible aligners in your community. So it's, you get the access that you need. You have the convenience, so you can do it at home. You can do it, at your time when you want to do it, and the doctor is able to do it at his or her convenience as well. And most importantly, we can do it at a cost savings of at least 60% than the traditional setting. So it's wonderful to unleash that power of that person's smile to positively impact their place in the world. So it's a great value proposition for everyone.
And a milestone in the industry, right? I mean, can you just hit on that a little bit? Why was this so big for the oral care industry?
Well, of course, we're an oral care company first. And then, of course, we created the first direct-to-consumer medtech platform. So it now has opened up tremendous opportunities for dentists and orthodontists to reach patients they weren't able to reach before. So it's just a wonderful, has had great impact on the industry. We're disruptors and we love disrupting the traditional setting. And it's just great for everybody because, again, we're an oral care company and it improves access to oral health.
Right. Well, and right now you're doing even more. You're solving a huge problem right now in the dentistry and orthodontic areas with closures amid COVID-19. First, I want to start off by asking how you guys at SmileDirectClub continue to serve your customers at this time. And then we're going to dive into a little bit about how you're helping kind of the dental and orthodontics community as well.
Yeah, no, that's great. And first, I just want to explain sort of the process on how our customers start their journey. And we call it a smile journey, the way they begin the process. And there are basically two ways to start the journey. First is to visit a smile shop where we capture a 3D image. Or the second way is that you could order an impression kit, which is sent to your home. So the first way for now is not really an option because we've closed our smile shops and we've suspended operations of our smile buses, which would go out to the communities and meet people and be able to reach where we don't have smile shops available. But we've closed them amidst this pandemic for a host of reasons. So right now, the focal point for us is to use our impression kits that can be sent out to your home. And all you have to do is go to SmileDirectClub.com to order an impression kit. So it's a great way to get started, particularly in an environment where you really can't do anything else at home. And they're doctor prescribed, the kits, and they're easy to use.
Oh, yeah, because I was going to ask, can you kind of explain how some people maybe have never done an impression before. I did one recently for teeth whitening stuff, but can you explain how the impression kits work and how we're able to actually do this all on our own by ourselves?
Yeah, sure. First of all, I want to make it clear that we have ongoing customer support that's available when you're doing these services at home. So you have some support through our customer care and our dental team, as well as, of course, the state licensed doctors in your state that you're located who will prescribe the care and can direct the care. So the impression kits, what we do is we send an impression kit. As I said, you can order it from our website. And also, we're offering a discount today at for our impression kits. They're $29.
Oh.
But how do you use it? It's a great question. There are a large amounts of directions in the actual kits themselves. And then we also have online videos. There are Facebook Live videos that actually I've done and some other people have conducted that are easy and a kind of an easy way to explain how to do the impressions. They're actually easier than you think. And we could also send you out an additional kit should we need additional impressions if in case maybe one area we missed. So we also have software that makes it more efficient, if you will, where if one side of the impression is not so good, we can merge it with the one side that is good. So it kind of works out really well. So it's actually easier than you think. The materials are easy to work with. So yeah, it's a great opportunity.
Yeah, definitely. And especially at that cost, I know my impression kit was about 5 times that price. So,
No,
so they
understood.
can get pricey. And, at this time where things are a little uncertain, that's really great. Are
Yeah,
you
and also,
continuing?
just real quick,
Yeah.
I just want to make sure that everybody understands too that our manufacturing and distribution facilities are cleaned and sanitized daily, and they wear PPE for the team so that they can be comfortable knowing the materials they receive are safe to use.
Yeah, and that's what I kind of was going to get into that, which is, are you continuing to see regular business at this time? If not, have you seen an uptick with people being home and able to kind of do this right from their own home? I know, like, for example, like I was saying, like teeth whitening for me was like something that I was like, well, I'm home, I might as well do this now. And face masks and those type of beauty routines. Are you seeing people order some of these, impression kits and starting to do this from home right now?
We are actually. It was a big part of our business, but now it's a significantly bigger part of our business, and it's really picking up in the orders since our shops have closed. So it's what it does is it provides people with the ability to start while they're at home. So it's a great
Right.
benefit at this time because now's the time to work on working out. It's do all the things that we want to do to make ourselves better. So this is like one of the first steps. So
Yeah.
yeah.
It's finding that silver lining, right? We all have to do it. We have to find some positivity in this, where we can. So how are you guys keeping up with that demand then? Is there anything that you've had to do differently? And like you said, you're making sure you guys are taking care of all the sanitation processes correctly. What about like in terms of shipping? Anything that you guys have to do different, or is it business as usual?
It's pretty much business as usual. We are prepared. We have been prepared to ramp up because our business has been growing in leaps and bounds. So, and by the way, we're often having to change the way we do things because we're always growing. So this, as bad as a process this has been, dealing with the pandemic and how scary it is, the good news is as a company, we've been able to leverage the tools that make us more effective. So it's really worked out well.
Yeah. So, this is as you guys have been growing consistently over time, you've kind of had to continue to shift. And this is just almost one of those inflection points in which you've done so.
Indeed.
Now, this isn't just serving your customers at this point. You recently announced you'll make the teledentistry platform available to all licensed dentists and orthodontists. How did you come up with this idea, and how are you able to execute upon it?
Well, it's not that hard to think that that's a next step to help the dental community. We want to partner with the dentists and orthodontists in the United States. We have 250 affiliated doctors. We'd love to grow that. But even besides that, we know that because of this pandemic, that dental offices have been shut down. So what we want to do is make sure that we can help. So 3 weeks ago, we felt we needed to do something to help in this fight. So we've actually, because we developed this platform, this original telehealth platform for teledentistry, we're opening it up to dentists that are not affiliated with us. So any dentist or orthodontist in the US that wants to maintain their practices in order to conduct follow-up care for emergency procedures and such can utilize this platform. And what's really great about the platform is that it has an app and a web app so that you can have interactive video as well as chat capability. So it's a great
Wow.
way to communicate with patients. And
Yeah.
again, in today's world, most dental practices in the US are shut down for everything but emergency care. So
Mhm.
that 70% of the dental practices are closed based on that, and another 19% are closed completely. So
Wow.
this is a great way for us to treat our patients and maintain that social distancing mandates that we're supposed to maintain. We can triage, we can do all sorts of services through the teledentistry platform, and it'll be available to any dentist or orthodontist that would like to use it.
I mean, what kind of preparation and resources and work goes into this? How did you make sure the platform could handle all of the licensed dentists and orthodontists that choose to use this platform?
Well, we're tech experts. That's really what our company is. So we're surrounded by tech, people, and as I said, tech experts. So it's not that much of a leap for us to be able to grow and expand quickly. And that's how we did it with this particular application as well. We were prepared for expansion as it was. So it was fairly easy to make sure that it can handle additional doctors who want to join, or not join, but able to use the application. So it's
Right.
kind of exciting for us. And not only that, but we're also supplying any dentist or orthodontist who would like to, continue to communicate with their patients for emergencies, that we're giving them complimentary 2 face shields, so that they're able to have, because a lot of their PPE has been donated to local hospitals and such, as mandated by the vice president and some of the local communities. So we're trying to help some of those local dentists and orthodontists. So anybody who's interested, they can contact us, and we'll be able to print up 2 free complimentary face shields.
Yeah, you're utilizing your 3D printing capabilities to do that, right?
We are, exactly. So we've had capability of expansion, because we've built for expansion and for growth. But based on this pandemic and how we're reacting to it, we opened up more capability to do more printing. We're one of the largest 3D printing facilities in the U.S. So we're able now to produce up to 10,000 shields a day. And we've been working on developing a reusable respirator mask. So,
Wow.
we're working with a bunch of organizations to make sure that the mask that comes out will be able to be safe and effective. And also, starting April 1st, we just started shipping out over 25,000 face shields to,
Wow.
yeah, it's really neat, to organizations such as the University of California in San Francisco, the Tennessee Emergency Management Agency. We also sent out face shields to St. Luke's Hospital in Boise, Idaho. So a lot of different types of organizations, and some second-tier healthcare organizations, that are not necessarily hospitals, but retirement homes and things
Hmm.
like that. So we're trying to be, all things to all people as much as we can. So not only were we able to support the effort against the COVID outbreak, but we're also able to do this while we're employing our workforce, our manufacturing workforce. So we're able to, by U.S. employees, make U.S. products to support U.S. healthcare providers. So it's kind of a cool story.
Yeah,
Um, and, and, and,
definitely.
and also we've donated our PPE, which were gloves and masks, in the shops. Some of our shops are located in CVS stores and Walgreens stores, and we've donated all of those PPEs to make sure that the workers in those shops are safe. The CVS employees and Walgreens employees are safe. So it's been
Yeah.
kind of an effort all around that everyone's doing to support the win against the COVID outbreak.
Yeah, I mean, truly, I say this, just thank you. I don't even know how to say more than thank you. It's so incredible to hear these kinds of stories and hear how companies like SmileDirectClub are pivoting on a dime and being able to help these people and these companies that need it the most. I have a couple things that I want to unpack in what you just said. So the first being going back to the 3D printing capabilities, you guys are normally printing clear aligners. So how do you shift into creating printing some of these much needed medical supplies? And with that, how do you get the supplies you need, the pieces and the parts? A lot of companies are seeing setbacks with some of the supplies they need to try to make, face masks or you name it. How are you guys handling that? And have you experienced any setbacks?
Well, look, it's kind of in our DNA to do this
Mhm.
kind of thing. Like I said, we're disruptors. We're used to shifting on a dime. So, we're a telehealth company, first of all. So we're a health company. And we're also FDA verified because we do class 2 medical devices. as a medical device manufacturer. So it's kind of natural for us to be able to make a shift like this.
Yeah.
So, and also we are still doing, producing aligners and retainers for our customers when we need to. So that's happening as well. So we're doing this in addition. So it's really been quite an effort. And like I said, it's been great because we're using our team that we've used, and we're just really excited about being able to contribute to the effort and also employ people as well at the same time. So it's exciting.
Right. So some of the materials that you would utilize to make, retainers or these aligners, that can be utilized to make some of these other much needed medical supplies as well.
Yeah, some of the materials are similar, and then also we've been able to get the materials that we need. We've done the research on how to assemble these, how to design them. So we have a great R&D team, and that R&D team is just wonderful. Like I said, we're so creative. Doing something like this was fairly easy for us, but we love the fact that we're able to participate.
Yeah. How are you keeping those employees safe that are helping do all of this?
Well, look, we follow all the protocols and we comply with CDC guidance and standards, as well as local markets safety guidelines. And of course, our US-based manufacturing facilities is FDA and OSHA certified, so it is safe. We do practice social distancing, not just on the production floor, but also in the break rooms and everywhere. People are educated on how to manage the situation, and everybody's been really working well. We've heightened our sanitation and our team member safety protocols, of course, using the gloves and masks and disinfectant products that are EPA registered.
Great.
So it's really been great. And by the way, we also have a lot of automation. So, some of these environments, they're automated lines, which is great. So there's kind of less operator touch points. So
yeah.
It makes it kind of safer for everybody as well.
Well, and that's what I wanted to ask. What role does visibility and agility, some of these automation processes that you have in place, what role does all of that play in making this kind of shift and doing it as quickly as you have? I mean, on the operations side, how did you get the visibility and agility you needed to do this?
Well, like I said, it's kind of in our DNA. We're kind of like, what if? We ask that question all the time. And when somebody says, "Well, you can't do it," we love to hear that because we'll figure out a way to do it. That's kind of what we do. Like I said, we spend a lot of time in research and development. We do a lot of time in testing. So for us to shift like this, it was fairly easy. So it kind of worked out.
And what role did NetSuite play? I mean, how has NetSuite given you the confidence to make these kinds of business decisions and to shift the way that you have? I know you talked a little bit about automation. I'm curious to know if there's any other role that NetSuite has played in this.
Well, look, as I said, the agility and adaptability are some of SmileDirectClub's best traits. So NetSuite's flexible system allows us to quickly shift as needed. So really helped us we use NetSuite's tools to be able to be flexible. So that's kind of how we are able to shift on a dime and make these changes that are necessary.
Yeah. To wrap up here, just a couple final questions. Did SmileDirectClub have a business continuity plan or any type of crisis management plan in place? A lot of companies do, but a lot of them have nothing to do with the pandemic that we're experiencing right now. And I'm just curious from your guys' perspective if that was something that you've kind of experienced too.
Well, yes, we do have crisis management plans in place and business continuity plans. And in fact, we had to initiate it a couple of weeks prior to the pandemic when tornadoes hit downtown Nashville.
Yeah.
So, we had we've prepared for this, and then we actually had it's sad to say, we had a reason to use it even before the pandemic. So really all of our systems were geared up and ready to go. So for us, it was really second nature to manage it. As much as we do not want to manage crises, we're pretty good at it based on the fact that we had the plan in place, and we actually even had to use it prior to the pandemic response.
Yeah. And moving forward, do you have, first of all, I want to ask, what are your plans to assist the dental community after this subsides? Can you tell us a little bit about that?
Well, sure. We want to partner with the dental community. As I said, we want to provide some PPE to dentists and orthodontists who might have problems finding them. For sure, face shields and hopefully a really well-designed reusable mask. But also, we are planning to make referrals for cases and other dental work, because our platform and our model is basically a gateway to oral health. So we find that 40%, more than 40% of our patients will report that when they use our aligners during and after, they go to their dental offices more routinely for checkups and for routine care and other services. So we
Yeah.
plan to be very aggressive and vigilant in making these referrals to our local dental partners who are not currently affiliated with us, just to sort of, make sure their businesses are promoted and propped up, and do the very best that we can to support them.
Yeah. And what about for SmileDirectClub? Like, how are you guys planning for the future? And is there a change that you've made or something you've experienced during all of this that you plan to, take with you into your strategy in the future?
Well, look, again, I think what's happened with COVID and actually even the tornado before, it just shows you need to be agile. You need to be on your toes and be able to be an organization that is lean and able to make changes. And that's kind of who we are. So for us in the future, I don't think a lot of us are kind of wondering what's going to happen. We're concerned about the startup of the economy and things like that, but we're ready to go. Our teledentistry platform is suited perfectly for going forward and managing social distancing and safety. So we believe that in our circumstances, we're here to help the community. We're poised and ready to do whatever it takes. And if we have to make additional changes to our platform, we're ready to do that. We've done that before, and we're ready to do it going forward.
Great. Well, on that note, Dr. S, thank you so much for joining us. Again, just so excited and proud to hear of everything that SmileDirectClub is doing to help our community right now, and keep doing what you're doing and keep smiling. And thank you so much for joining us.
Well, thank you for having me.